everyone. I am Dr. Payal Sharma from the Department of Psychiatric Nurses going to present you the topic mental health issues in adolescents during COVID-19 pandemic. In this chapter, in this topic we are going to discuss about the all the mental health problem and issues which are happened in the COVID-19 and what are all the solutions and strategies we can use and the students or the adolescents have to use to cope up from the any type of mental health issues. So we are starting with this. What is adolescence? Who are adolescents? The adolescents are students or the children's or the young age from 12 to 19 years. It is a very unique and formative time. It is a very crucial period also because due to this there are many hormonal changes and the habit changes are happening, and this because of this hormonal changes sleeping pattern is getting disturbed, and that for a sustained teenage we need a regular routine. For example, we have to develop bodily exercises, like we have to do exercises which can heal our body as well as our mental status. So for this we are promoting the psychological well-being, and also we have to protect the adolescents from the adverse experience or risk factor. As we all know, the COVID-19 has a great impact on our mental health issues because we have done all various things which is not we have not done earlier. For example, we stayed in a house, we have nothing to do, we have a screen time more than then so these are all the some problems which have some mental issues on the, and the adolescents are the age in which in this age the person like to have go with the friends and chill out, and due to this lockdown, due to this pandemic, the person is not able to go out and not able to interact with the person. So this is the problem that is the mental issues which have to be uh, conditions which can be occur to an adolescence. So this is the adolescent part. Now, how COVID-19 impact teenage mental health? In this we can found as we see in COVID-19 has brought a set of newfound of fears of getting infections or even of the dying also. So already the person is in the mental stress. So in this adolescence we has already I have told you that in this the person is the teenage is the age in which the children or the adolescents like to go with the friends, hang out outsides, and they have the new challenges, new colleges. So these are all the things which they have to explore, and this is a very crucial period of the development also because of the hormonal changes. The person may got the intense emotions, fear, anger, sadness, panic and grief, and suddenly the safety and security problems in this age because we are very this in this scenario or in this particular age the person is having the career problems, or and this is the age for the crucial of developing career as well as the personal issues. So what are all the process we can see? The impact of infectious disease outbreak on a mental health is like have the impact, the process ke how the person have got this problems. So first is the impact of this COVID-19. The adolescent has got the adverse impact on the mental health because of this COVID-19. Then this pandemic has led to the public to experience a psychological problem as पोस्ट ट्रॉमेटिक स्ट्रेस डिसऑर्डर. फॉर एग्जाम्पल कभी कभी ऐसा लगता है कि चीज़ हो गई है तो पर्सन इज इन द स्ट्रेस की फॉर एग्जाम्पल द पर्सन is fearing that the COVID-19 will take his life or something. Then developing assessment of the trauma leads to adapt adopted maladaptive strategies such as arousal of symptoms, invasion, and strong. And because of the less coping strategies and less self control and less confident, the person may have the maladaptive strategies. So for example, the person may get OCD also, the person may got the strong negative emotion. So this is the process which can give an impact on the COVID-19 in the adolescents. Then common mental health issues in the adolescents during the COVID-19. The first we will see the non-stop pandemic news. Is there are non-stop pandemic news. For example, the person is getting a hearing from here and there on newspaper or from the news channels that that one person is died because of the COVID, and this one person is having some problems, and the world is getting problems. So this is getting more and more adverse. So we have to do things like the person may not get any news because some of the news are fake also, and the person will get panic. Then the loved one becomes, because we are in the lockdown with the people in the pandemic, so we are listening that our most loved persons like grandfather, grandmother, they are ill. So this create a mental stress. Then loss of traditional milestone, like for example traditional milestones, like the person is have to go to the college in that particular year. He is not able to going to the college because of the some this COVID pandemic. So these are all the things. Then missing friends. This is the very important aspect of adolescence. Then loss of work, that there is no particular work as the school and colleges were closed. So this created mental problems. Then family economics also, as the in the pandemic the person is having the a low work, so he is not getting that much of economically independence. For that reason also the person is going for not going for the work, and he is not getting incentive for that. So for this reason also the economic condition of the family is also getting imbalance. Then additional quarantine related to the then quarantine is the, for example, the person is suspected from for the COVID-19, so he is getting quarantine. So in the quarantine also the person may have, because he can't interact with the patient, any person, he can't go out, he can't. So because they have to stay in a one room, so it is very difficult to be in a one room, and it is cut off from the whole world. Then physical changes also, the physical changes, because we are in a lockdown, we are not able to go outside, so it is our weight is gaining, or excessive use of mobiles is getting strain to our eyes and other devices also. So we are having some irritation in the because of this particular duration. Then another quarantine associated like absence, substance abuse, alcohol abuse, eating disorder, because we are not going out, so we are eating something. And career uncertainty, we are not interacting to the people, we are not interacting to the person who can give us job वगैरह. So these are all the problems. Then behavioral and emotional changes. What is the behavioral and emotional changes? Because staying in a one particular staying in a one particular place, it is getting irritated, we are not getting socialized. And then we can also have the ideas of suicide and depression and self harm also, because the person may think that there is no life further, there is no life, there is no opportunities, there is nothing. So these are all the problems. Then frequently asked question, the adolescence is, according to the UNICEF, we have some frequently asked question that the adolescents may have the easy, it can be easily catched by the adolescents, or the questions like the people adolescent can have the mild problems, or they. So these are all the some questions which can be asked by an adolescents regarding the COVID-19. Then I am on medication for chronic health conditions. Should I change anything? So these are all the some basic questions which which were the frequently asked by the, and it is given by the UNICEF. Then like the questions like, I am bored staying at home, I am very unlikely to get severe illness. If I was to get COVID-19, why it is important to follow the guidelines? These are all the main some questions. You can have a glance on it. Like school, when the schools are getting reopened. So these are all the some most frequently asked questions. Then they are missing out their educations. Then online contacts like online courses. Then touches, how the disease gets spread and all. Then what are all the, now we have discussed about all the mental health problems. Okay, what are all the mental health problems which can be faced by the adolescents. Now we will see about what are all the coping strategies they can use to cope up with that particular issue. So first is to work together to create a normal. We have to do work together to create a new normal. Then stick to a schedule. Now as we are at home, we are not having any schedule. Like for example, anytime we are waking up, anytime we are eating, anytime we are going to bed, this is, we are not having a particular routine. So for that we need to have a routine. Like for example, like normally we have to wake up on some particular time, then we have to take our breakfast, then we have to do our some work, exercise, something like that. So if we are having scheduling, so we have a body or the circadian cycle. Okay, for example, downtime also, if in this time we have to complete this work like this, then communicate honestly and openly. Then we have, what we have to do, we have to share the information what is exactly happening, stop spreading the fake news. So this is the way to communicate, and communicate honestly. That means we are not on that is the fake news we are hearing, we are not going to spread this. The honest details and the data that exactly is being happening in this country, that we have to only spread, or avoid to talk about that particular, these are all the negative news, so avoid that particular news. Then stress that lying that staying home and saves lives. Like uh, we have to be honest that if we are staying in the home only, then we will be survival, we will have the more chances of the survival. Then talk to the parents, should have to talk to their teens, because the teens are not greatly involved in the families, because they have their own space, they have their own environment. So for because of this pandemic, the person is in the home only. This is the parents responsibility to talk with their teens and to help their teens to look forward. Okay, what are all the that career options, and what are all the things which can be for this year, you should not, you are not doing this, so next year you can do like this. So we have to motivate our adolescents. Then stay safely connected. Then you have to connect it with your friends, family, virtually, because if you are not because we are not able to communicate each and everything to our family members. So they are the friends and the relatives which are far away, but we are very comfortable with them. So the things which are not able to share with the family members with whom we are staying, so it is easier to talk with the cousins and the family members. So we have to connect it virtually. If you are which is your favorite auntie, uncle, you have to communicate with what you are feeling like. So you have to have a mental ventilation. Then we have to help other to connect also, the person, those who are not able to connect, it is technologically, it is very low, so you have to help others to connect. Make a Zoom app, make every person, family members, to join in. You have a place and conversations with them, then they can ventilate accordingly. Then support family and community. You have to support, you have to just, we have discussed virtual guests, family projects, give family project like exercise at 10 a.m. you have to wake up and we have to do exercise togetherly. So on Zoom or any platform we have to do like this, you know? Then declutter and donate. They donate also, the people is very needy. If we are donating something, we can feel good. So for that reason we have to donate also. Then volunteer within the committee, and you can be a volunteer also. You are providing the food, you are providing the medicines, like in the during pandemic, because the poor peoples are not able to give the poor people are not able to earn themselves. So this is the community services that you have to provide. Then is mind, body, and health. This is the three aspects. So you have to do yoga, meditation, pet therapy. You have to enhance your hobby. Then workout you have to do, managing budget also, and recreational creativities you have to do. Then you can take the professional help like telemedicine and telepsychiatry. If you are having any health issues, you can go for the telemedicine. You can take prescription from the online, and you can take the medicine. And then the telepsychiatry like the same, if you are feeling any stress or anything, any mental issues, so you can go for the online counseling. So this is all about the so this is 15 मिनट का बना रहे. Hello everyone. I am Dr. Payal Sharma from the Department of Psychiatric Nurses, going to present you the topic mental health issues in adolescents during COVID-19 pandemic. In this topic, we are going to discuss about all the mental health problem and issues which are happened in the COVID-19, and what are all the solutions and strategies we can use and the students or the adolescents have to use to cope up from the any type of mental health issues. So we are starting with this. What is adolescence? Who are adolescents? The adolescents are disorder. So we have to connect it word to. So we common earn themselves. So this is the community services that earn them. You can take prescription from the online, and you can take the medicine. And then the telepsychiatry like the same, if you are feeling any stress or anything, any mental issues, so you can go for the online counseling. So this is all about the so this is